Healthcare, as you know, it is a huge expense and getting more expensive all the time. But did you know medical bills are negotiable and you can get medical care in Georgia for free or a discounted price just based on your income?
Listen up, a lot of people want to know this is true, and state leaders are trying to help spread the word. Savannah Levin's live in studio to be that voice this morning. Savannah, medical debt is something so many people unfortunately have. It can really be a domino effect for your life.
Yeah, and that's why I'm glad to be the voice of this good news this morning. So census data shows that 43 million Americans have past due medical bills. You might not be surprised to hear that. And more than 1 in 4 said that they couldn't pay for necessities like food and heat because of the debt. It's such a sad cycle, and a Georgia nonprofit now is using a new grant to tackle that issue here at home.
Just living day to day was incredibly hard.
Sarah Olson's endometriosis journey has been one of seemingly endless pain.
I had seen so many different gynecologists, specialists, doctors. I'd been to the ER so many times in extreme pain.
And with that has come extreme medical bills.
It's not being covered by insurance, and so we're having to pay out of pocket, and the costs are just insane. Total, it's been around $15,000.
Sarah, a newlywed college student, feels she's already being buried by debt.
I cry about it a lot. It's really overwhelming and hard to know what to do or where to turn. It's a lot to handle, that's for sure.
Her story is like so many others.
People just don't even know what their rights are.
Liz Coyle is executive director of Georgia Watch, a nonprofit consumer group that was just awarded a $190,000 grant to help Georgians lower or eliminate their medical debt.
We often will find out that someone who has contacted us is someone who obviously would have qualified for a financial assistance policy so that their bill was either nothing or substantially lower.
She says there's often a lack of transparency in medical billing that leaves people feeling stuck.
Sometimes they just need an organization like ours that it can explain to them what their rights are.
Here are some things to know. First, if you're planning out care or a procedure ahead of time, make sure the provider is in your insurance network and ask for a list of estimated costs beforehand. Under state law, providers must disclose that information if you request it. If you don't have insurance, search for providers within the Indigent Care Trust Fund or ICTF network. That's a state program that covers some or all costs for low-income patients. And once you get your bill, know that you can dispute and negotiate any and all charges. And there are nonprofits like Georgia Watch that will help you for free.
We need to make sure that nobody in Georgia doesn't seek health care they need because of the fear of the unknown.
So we know that was a lot of information very fast, but don't worry, we've got all that plus more info on 11alive.com. Chesley?